I'm going to talk about nitro compounds. The nitro compounds has several drugs in them, such as nitroglycerin, sodium nitroprusside. We'll talk about the examples later. But these drugs are really important as a nurse if you're working in the intensive care, because you'll be giving these drugs to your patients very often. So you need to know what are the side effects, how it works, and what to look for if you're a patient on the nitro medication. So let's talk about the mechanism of action first. So there are vessels. Let's talk about the vein or arteries, and they have this vascular endothelial cell in the veins or arteries, basically the vessels. They produces the nitric oxide substance, and that nitric oxide substance is responsible for the vasodilation. When it does the vasodilation of arteries and veins, so let's talk about in each, like what happens when it does the vasodilation of veins. So when it causes the vasodilation of veins, vein can hold more blood. So the amount of blood that's gonna get back to the heart, it's gonna decrease. When the amount of the blood that's gonna get back to the heart, it decreases. It's not, so the heart doesn't have to hold increased amount of blood. That's gonna decrease the pressure on the heart wall. It's just a general mechanism. If you have more blood in your heart, it's gonna put more pressure on the heart walls, and it's gonna stretch more. If you have less blood in your heart, it's gonna put less pressure on the heart walls, and it's gonna stretch them less. So that's basically this amount of stretch the heart wall has. It's called the preload. So it's going to decrease the preload by decreasing the amount of blood getting back to the heart. Now it's going to decrease the afterload as well by causing the vasodilation of artery. So when ventricles eject the blood out of the heart, it has to overcome the pressure of the arteries. Now if arteries are constricted, that means that's too much pressure. The heart has to pump really hard in order to come over that artery pressure. Now if it is dilated, there's not much pressure in the arteries, so heart do not have to work too hard in order to pump the blood out of the heart. So that causes the decrease in afterload, that basically reduces the workload of the heart. Now there's a third action this nitric oxide has on our heart, is it prevents the coronary spasms. It causes the coronary dilation. So these three mechanisms are important in order to understand this nitrous substance. Let's talk about the next slide, in which disease condition we use. So first of all, the hypertension. As we talked in the previous slide, it dilates the arteries. That means it decreases the high blood pressure, basically. So that's why it's used in the hypertension as well. Now when there is a heart failure, that means the heart is not working right. It's a pump failure, basically. It's not pumping blood adequately into the body, into the systemic circulation. So we need to decrease the workload of the heart, which absolutely this drug does. So we can use these drugs for the heart failure as well. And when there is a coronary spasms, angina, or myocardial infarction, we can use these drugs to dilate those coronary vessels, so we can provide more blood to cardiac tissue. So the use of these nitric compounds are basically main three: the hypertension, heart failure, and angina and myocardial infarction. So what drugs are in this class? The first one is sodium nitroprusside. Sodium nitroprusside is mostly work on arteries, so it is it's highly used for hypertension only. When someone comes with a hypertensive emergency, like when their blood pressure is like 250 over 140, then they usually put them on the nitroprusside drips. There's isosorbide dinitrite, isosorbide mononitrate, and you have probably seen in this drugs a lot. Nitroglycerin, well, if someone has a myocardial infarction, angina pectoris, or even a high blood pressure, they would put them on the nitroglycerin. So these are the four main medications in this class. The next one is side effects and contraindications. So one of the main side effects of these drugs is orthostatic hypotension, because it dilates the arteries and veins, causes the really profound hypotension. So that's the one you have to really be careful when you're giving these drugs to your patient. And when you're giving these drugs to patient, teach them to not get up suddenly, because when you get up suddenly, it causes the big drop in the blood pressure, and then they can feel dizzy and then they can fall. So tell them, like, from lying position, rise slowly to the sitting position and wait for a couple minutes right there. And if they don't feel dizzy, then stand up there for a couple minutes. And if they don't feel dizzy, then and then do all other activities. Otherwise, they can have really big drop in the blood pressure, and then they can feel dizzy and fall. The other ones are headache, flushing of the face, because all the arteries and veins are dilated, and holding all the blood in them causes the redness of face, and flushing as well. And it can cause the reflex tachycardia as well, because there's not enough blood getting back to the heart. So heart's thinking, okay, I need to supply more blood, so it will start beating fast. So it causes the reflex tachycardia as well. Now, one of the main question and contraindication in NCLEX they often ask is nitro compound and sildenafil, which is often used as a Viagra. So you do not want to put patient on nitro and this drug at the same time, because it can cause a really big drop in the blood pressure. It can impair the coronary artery perfusion, and can worsen the angina, or it can cause even MI, myocardial infarction. So this nitro compound and this sildenafils are contraindicated. You do not want to give patient these both drugs. So be really careful, and they ask this question very often as well in NCLEX. So remember that one. And orthostatic hypotension as well. Alright, that was it about the nitro compound. If you have any questions, you can let us know. Thank you for watching.